So I'm here with my friend, Dr. Judy Croff, who is faculty here at OSU, as our interview the expert for today. Julie, would you mind telling us a little bit about what you do?
Well, my training and my background is in public health. So the main concern is population level health and not really examining individual level, but more population level. And sometimes individual level is important for that, and sometimes it's not. So the way I like to think about it is there's a normal curve in any population, and we just want to shift that curve to be healthier. So my research has traditionally been on alcohol and other drug use, and specifically looking at person-environment interactions. So we go to bars, we go to parties, and we examine the environment, what predictors in the environment may encourage people to use alcohol more or less or use other drugs, and actually collect biomarker samples so that we really know what their behaviors are. It's not just self-report of how many drinks they have.
Okay.
Because, as you know, people are not always very accurate when you
Right.
ask them how many drinks they've had.
Right.
Unless they're drinking beer.
Particularly if they've had a few.
Right.
Right.
They may forget. I have one classic picture from a Google search where this young man wrote on his arm in a Sharpie every drink that he'd had. So you could see all the way down his arm on both arms.
He didn't just mark, he actually wrote like a
He
description
wrote the
of what
number.
it was? Or,
I
okay.
think he was, it was beers or something.
Gotcha.
It was probably a 21st birthday where he was trying to get to a certain number and didn't want to forget.
Oh, so he was trying to get a big number.
He was trying to get a big
Okay.
number. There were a lot of numbers on his arms.
We sometimes recommend tracking as a moderation strategy, but not in his
Well,
case.
yeah, and actually, we've thought about, okay, could actually breathalyzing people be used as a tool to moderate
Right.
their behavior? But then when we are around college students, the goal is always the biggest number.
Right.
So that
Right.
would be counterproductive.
Right.
So at parties, we found things like having having a bong in the room increases BACs.
Huh.
It's a signal that this is a real party. Having a keg at a party actually decreases BACs of participants.
Really?
So that was our initial reaction, was like, that's a pretty big access point for alcohol.
Right.
But then we thought about it. Thinking back to college, did people plan ahead when they had keg parties? Not a whole lot. So when you go to a keg party, you are waiting in a long line. Everyone's drinking out of the same keg. You finally get up to the front after waiting in this long line. You pour your beer, half of it's foam.
Right.
And you don't have two cups, you have one cup, and you drink your beer, and then you get in line again. So it
Right.
actually slows down consumption quite a bit.
You drink half a cup because half was foam.
Yeah.
Right.
Yep. And you have a wait between. BYOB parties, you bring a 30-pack, you finish a 30-pack.
Huh.
So
That's
BYOB
interesting.
parties have much higher risk. At bars, it's more about, it's absolutely the same sort of situation. It's about access. So if there are temporary bars set up, if there's a drink special and someone's walking around with shooters of a drink, that increases BAC. If there's dancing, it decreases BAC. If we have tables to set our drinks on, we tend to set our drinks down and we'll talk and have a conversation, right? But if it's a really loud bar and there's no tables to set
And
your
it's in your
drinks
hand
down,
right here.
then it's in your hand and you're drinking very quickly. Your BAC is spiking more quickly. So looking at those sorts of factors and then working with bar owners to try to do things
Right.
that are preventive in nature.
And I suppose that's a cycle that the faster you drink, the more you want another drink.
Right, but then your BAC is peaking very quickly.
Right.
And you're not getting, if as a bar owner, you're going to have someone who maybe has 3 or 4 drinks.
Yeah.
But then they're going to be too intoxicated to continue
Right.
drinking or to continue serving that
So
person.
you found bar owners receptive to ideas of,
Some.
yeah.
Some of them don't want to have anything to do with us.
Sure.
So there's a bit of salesmanship that's involved in going to bars and saying, we're not necessarily concerned about alcohol use in particular, but we are concerned about the harms related to alcohol.
Right.
We're concerned about the fights. We're concerned about DUIs, and those are things that affect bar owners.
Yes.
So, and here in Oklahoma and many other states, the bartender is liable.
Right.
If someone gets in a car drunk and then kills someone else, that liability traces back to that
Sure.
bartender.
Sure.
So,
So in some of my work, where I work with the individuals trying to moderate their use, you're working with the environment
Yep.
to try to make it less conducive
Yep.
to higher levels of use. Really interesting.
Yep. Yep.
How did you come to do the work that you do?
Mentorship.
Okay.
Standing on the shoulders of giants. My master's program, we were all randomly assigned a faculty member advisor, and mine was Bill DeYoung.
Okay.
Trained as a psychologist. And so I started working with Bill on alcohol use and other drug use when I was at BU. Moved back home to San Diego, and there was an alcohol research lab there that said, well, you just trained with Bill, you need to come work with us. So I started working with Jim Lang and John Clapp. One's a social psychologist, the other's a social worker by training. So really interdisciplinary group of academics that I got to work with. When I first went to work with Jim, he had an NIH award. So it's collaborative. We were working with 3 other universities trying to prevent alcohol use problems among college students, which is a lot of what Bill's work has been, and it's quite a challenge.
Yeah. So if you could put yourself back when you were an undergrad, maybe in a health psychology class,
Yeah.
Are you doing now what you thought you would do then, or did you just sort of stumble into things that interested you?
I think I stumbled into it.
Okay.
When I was an undergrad, I was a biology major.
Okay. Me too.
I was pre-med.
Me too.
And I liked the idea of helping people, but I didn't like the idea of the medical system and the way the medical system was set up. I got very involved. We had an undergraduate chapter of the American Medical Student Association, which is interesting. So we had a pre-med chapter.
Okay.
And so I was at their national conference, and this was early 2000, 2001, maybe 2000, maybe 1999. We marched in D.C. for access to healthcare for all. And it was one of those moments where it's like, well, just treating the disease it's not enough anymore. We need to back up, and we need to do prevention. I became really involved as a peer health educator at that time. And so maybe that was about the transition point for me, where I wanted to switch to prevention. Had some mentors that had public health background.
Right.
So.
And then your specific interests were really shaped by the mentoring that you got.
Absolutely.
Sure.
Yep. I think your connections help give you the opportunity to shape where you get to go.
Sure.
So it's cool that your students have that.
Yeah.
Yeah.
Any advice you'd have for students in a class in health psychology today of who might be thinking about future careers or?
Well, I mean, certainly my slant is for public health. I think it's a great wave. I think it makes you someone that can work in a variety of settings. My training's mostly social behavioral health promotion. We need people who have a good understanding of interpersonal and intrapersonal dynamics, and I think that psychology undergrads certainly have that. And that our role would be then training on, how does environment interact with people, or how do perceptions interact? How do we shape those perceptions through the environment or through other things? So I would say explore grad programs. I'm all for more and more and more education.
Right.
So that's my biggest piece of advice, whether it's additional psychology programs or public health programs. I think that would be a great thing to do.
Right. And I think part of what I'm hearing from you and your path is you don't have to know exactly what that outcome's going to be, just sort of follow your interests. And
Absolutely. Yep.
well, thanks so much, Julie.
Thanks.